everyone, I am Nikka Andrea as Pilas from BSN12-E, and today I am going to perform a perineal flushing return demonstration. So perineal flushing involves cleaning of the private areas of the patient, the perineum and the genitalia. So this is done for the purpose of removing the perineal secretion and odors to prevent infection and contamination, and also to promote the client's comfort. So, perineal flushing is indicated for the patients who are in labor and in postpartum, for patients who have perineal repair, for comatose patient, for bedridden patient, and for those who have an indwelling catheter. So, prior to the conduct of the procedure, I have prepared the necessary equipments to be used. This is to conserve time and energy. So this includes a container filled with warm water, kidney basin, my clean gloves, 7 pieces alcohol or dry cotton balls, and 7 pieces cotton balls soaked in a cleansing solution, my bedpan, my rubber sheet, my perineal pad, and the my sterile forceps. So after that, I have also performed hand washing to protect my patient and myself as well from infection and cross-contamination. So now I'm going to introduce myself to my patient, verify my patient's identity, and explain the procedure to my patient to gain her consent and full cooperation. So, good morning, ma'am. I'm Nikka Andrea as Pilas, your student nurse for today. So, may I see your hand, ma'am? Please state your complete name and your birthday. Okay, so how would you like me to call you, ma'am? Okay, so today, ma'am Panda, I am going to perform the perineal flushing. So, basically, I am just going to wash your genital area so that later, you will feel more comfortable and refreshed. Will that be okay? Okay, so before we start, I am just going to close the door so that no one from the outside will disturb us while doing the procedure. And also, this is for you to give your privacy, okay? Okay, so after doing so, we have to place the patient in a dorsal position or dorsal recumbent position. This is to provide a good visualization of the area to be cleansed. Okay, so ma'am, I need you to flex or slightly flex your knees, and I need you to lift your buttocks. So I will help you to lift it so that I can place the bedpan. Okay, so I will just first place this one. Okay, so I will help you. Okay, so can you please lift your buttocks? Okay. Okay, so now I will place the bedpan. Okay, so can you please raise your buttocks again or lift? Okay, so 1, 2, 3. Okay. So after doing that, I am going to wear my working gloves and then start the cleaning the perineal area of my patient. So I'm just going to wear it. Okay, so now I am going to expose the genital area. So we have to remember that expose only the area to be cleansed. So this is done to help to help the patient avoid from getting chills and embarrassed. Okay, so now I'm gonna expose the I will flush the perineal area of my patient with warm water. Okay, so as I was doing that, I am also inspecting for the perineal area of my patient, noting for any particular areas of swelling, inflammation, excessive discharge, and presence of odor. I also using warm water because warm water will soften and dissolve blood clots and if there are any, and also to prevent the patient from having chills. So to proceed with the cleaning, I will place my kidney basin here. So this is where I am going to discard the used cotton ball. So now I will get my cotton balls and my sterile forceps. So now I am going to get a cotton ball soaked in a cleansing solution using my pickup forceps. This is to maintain a sterility. So first, I am going to cleanse the external genitalia, starting from the midline of the symphysis pubis to down to the anus. So remember that when we do this, we should never retrace a stroke. So this is to prevent contamination of the area. So we're gonna do this and discard. So also we have to remember to clean from the farther side, which is this one, first. So next, with the second cotton ball, we have to cleanse starting from the mons pubis in figure of 7 by way of external labium towards the anus. So we have to figure 7 and then from the anus and discard. We also do it likewise on the opposite side. Okay, so from the anus. So with the fourth cotton balls, we have to cleanse starting from the mons pubis, also on a figure 7 by way from the external labium towards the anus. Discard. And we're gonna do this on the other or the side that is near to us. Okay. So now with another cotton ball, I will clean the groin area starting from the groin up to the thigh. So I will use the other side of the same cotton ball for the near groin. So this one, fourth, so next. Okay, so we're gonna discard this one. So after doing that, I will flush the perineum thoroughly with sterile warm water. Okay, ma'am, so I am going to pour a warm water over your perineal area. Okay. So now using a dry cotton ball, I will dry the perineum with the same stroke I did earlier. So we're gonna get a dry cotton ball. So I am going to begin in the middle or the midline of the symphysis pubis down to the anus. Okay, so we're gonna discard this one. Next, I am going to pick another cotton ball and clean the majora by way of figure 7 down to the anus. Okay, discard and the other side. Okay, so next I am going to pick another cotton ball and clean the labia minora, then another for the other side. Next, for the other side. Okay, so we're gonna discard this one. Then I am going to dry the groin area. So we have to do it the stroke earlier. So okay, so the other side of the cotton. and discard. So after that, I will remove the bedpan and turn the patient to side so that I can dry her butt cheeks. So ma'am, can you lift your buttocks? Okay, so we're gonna remove this one. Okay, so now ma'am, I'm gonna help you in a side lying position. Okay, so now we're gonna pick one cotton ball or dry cotton ball, and we have to dry the butt cheeks and to the other side. Okay, discard this one. So now, ma'am, you can now lay down. So next, I'm gonna spray with antiseptic as needed to promote healing. Okay. Okay, so after that, I'm gonna put the perineal pad with an up-down motion as needed. This is to prevent the contamination of um, the vagina and the urethra from anal area. So we're gonna discard this one. So I'm just gonna put it like this. And I will put the patient's pants as needed. So now I'm gonna cover the patient. Okay. Also, I will remove this. Okay. Okay, ma'am. So now that we're done with the procedure, so how do you feel, ma'am? Are you more comfortable and refreshed now? Okay, so that's good to hear. So now, since that we're done with the procedure, I am going to leave you now and let you have some rest. So if you need anything, that just don't hesitate to press the call button so I can go back and attend your needs. Okay? Okay. After doing your procedure, I'm now going to proceed to the aftercare of the materials used. So lastly, we have to record the treatment done to patient and the discharges that are observed. This is because for documentation purposes, the procedure was done and means of communication.